Hello everyone, Dr. Kimball here. I'm going to take a minute and go over another interesting case. This is a reasonably common pathology or spine problem that I see, but a little bit of an unusual presentation. Just going to walk you through it. Hopefully you find some value here. So I'm going to click over to the films. Again, I always remind you to go over the how to read your MRI video that I did. That'll help you walk through this if you're trying to read your own films. So starting out, this is a side profile or the sagittal view of the spine on the left, and then here on the right side is a top-down view. We call it an axial view. This lowest level is the L5S1 level. It looks pretty healthy. There's something going on here at the L4-5. You can see that these vertebrae are just minimally malaligned. I've got this cross-sectional line down here over more around the 5-1 disc. You can see the spinal canal, this little roundish, whitish area. That's where the nerves lie. These little black dots are the nerves. And there's nothing pinching them, nothing compressing them. They're free-floating, perfectly happy. As I scroll up to this level at 4-5, we're going to see something change there. And you'll notice that you can no longer see the nerve roots. You see some arthritis from these facet joints on each side pushing in, a little bit of bulging of the disc. And that space that was much larger and allowing nerves and spinal fluid to pass by is now just barely allowing the nerves to get through. So they're really pancaked in there. That is called stenosis. Again, stenosis is a medical term for narrowing of a normal space, and the stenosis here is caused by arthritis. Well, this patient has two different things going on. One, she's got arthritis of the facet joints, but she's also got a slipping of the vertebrae. We call that a spondylolisthesis. This is a very classic presentation. I see a lot of patients for this. So what I'm doing here is I flipped over to a copy of some X-ray films. You'll notice, obviously, this is the same patient, but this view on the left is the extension view. The patient's leaning back. Here's that 4-5 level. You can see this little stair step there. Interestingly, when the patient leans forward, it actually slips forward a little bit more. So now we've got a scenario where there's stenosis at this level, but there's also failure of the joint to hold the vertebrae in position, and that can cause additional pain. The most common symptom that patients will have when they get stenosis in the spine is a symptom called claudication, which really is when you stand up and you're walking or upright, the nerves are more pinched, and they can cause a feeling of tightness, aching in the quads, the hamstrings, and almost a feeling of that your legs are tired or they're going to give out on you. People will commonly lean forward on a grocery cart. They feel better when they're leaning down, when they're walking down the street. Get a block down the street. They're constantly looking for the next place that they can sit down. That is claudication. That is a classic symptom of stenosis. This patient has some back pain. She has some symptoms of aching in her legs, but her primary complaint is a little unusual, and it's tailbone pain. I would say that that is extremely unusual presentation for stenosis. That's one of the reasons why I wanted to share this with you. The thing about her tailbone pain that makes me think it's related primarily to her nerve impingement is that it's worse when she's standing upright. It gets better when she sits down. That kind of allows me to feel and relate it more to the stenosis in her spine. That coupled with the fact that she has had a very, very good response to a diagnostic epidural steroid injection. Said she got 100% relief with the steroid injection at this level. That's also very good news, and that helps me to confirm, yeah, we're looking at the right spot. This is where the problem is. You may have some atypical symptoms that don't fit the typical profile. What you need to do is find someone that is going to take the time, listen to you, review your films, go through them with you, and help you understand what the best therapy for it is. I can go over this patient's plan. She's going to end up getting surgery. I can walk you through that at another time. We'll save that for another date. Hope you're having a great day.